Thank you very much for having me. Get to talk about what I do, which I love. Please ask questions. Small enough group, obviously. Ask any questions of any kind as we go along. Don't feel like you got to wait for me to stop yapping to ask questions. I actually prefer my administrator's intro of me. I've known him for a long, long time, and we're just friends too. And he says, "This is Dr. Dave Demarest. He used to be a pretty good basketball player, not anymore." Thank you, Pat. And for a psychologist, he's a halfway normal guy. So, low bar. All I got to be is halfway normal, and I'm good. Good Midwestern boy. So I'll try not to talk up myself too much here, but neuropsychological evaluations are important for lots of different populations. I love kids. I got one. I thought I'd want to work only with kids. When I was an undergrad, the volunteer stuff with kids with disabilities. I worked in a camp for spina bifida kids every summer because I loved it. And then I was sick of grad school, so I left and I worked for 9 years before going back. 7 of those were at Yonker Rehab in town here. And I worked with a couple of neuropsychologists at Yonker Rehab, and I did more adult stuff and lots of different kinds of populations of people. And I like variety. So in my working life, I've wanted actually to work a very wide variety of ages. So I have evaluated people as old as 104, believe it or not. You can actually evaluate a 104-year-old. There was finally at 104 a question of dementia, whether he was dementing. Finally, it's like, really? Do we really need to put this guy through all this testing stuff? But it was important. There was questions of placement, and he couldn't live at home anymore finally, and kind of where was he at? We'll get into this. Kind of where was he at? And I've evaluated. When I did my internship, I did a year-long rotation working in a team concept with physician and educational staff and OT, PT, speech, and psychology/neuropsychology, working with human beings about that long, looking for developmental delays. So really, really young. So I do dementia evaluations. Again, we'll get into this more. I do dementia evaluations for older folks. Any central nervous system problem, that's kind of my background. I don't do a whole lot of spinal cord injury stuff these days. I have done some of that before too. So that's a little bit about me. Some of the initial slides are a little busy maybe, a little technical. I'll put them up there and make a couple of comments and you can read. And again, please ask any questions of any kind. I should say this. I always make a point. I work at On With Life. Who's familiar with On With Life? Okay. We're in Ankeny. We're on an inpatient basis at least. We're a rehab center for people, mostly no little ones. The little ones with those kinds of injuries go to child serve. But we see adolescents and adults who've had traumatic brain injury, automobile accident, falls, you name it, and stroke, people with stroke. So sometimes I always make a point to tell people a little bit about my background and me when they come when I'm working with a kid, because you drive into On With Life and you see traumatic brain injury, and if you have a child with autism, the 4 main congenital conditions that people are born with, autism spectrum disorder, intellectual disability, used to use the term mental retardation, don't use that anymore, intellectual disability, learning disorders, we used to use the term learning disability, it's learning disorder now, and ADHD or ADD. I do those evaluations, I'll talk more about that. I work with people with those conditions on an evaluative basis, on an outpatient basis. So people come in and see traumatic brain injury and they have a child with an autism spectrum disorder and wonder, what am I doing here to seeing you? Yes?
What if, so I adopted my son when he was, 6 months old.
Yeah.
And he's from Kansas City, and the mother did a lot of drugs.
I've heard this. My name's out there with the adoption community. I get lots of kids.
And at any rate, he's 18 now.
Yeah.
He was
Yeah.
And always thought that was what it was.
Uh-huh.
Had him tested. He doesn't have a
Uh,
learning disability, so to speak.
right.
But there's something
But there's
that
problems.
prevents him from
Yep.
functioning. Is that the type?
Yeah, that's what we're going to talk about today.
Okay.
Yep. Yeah, I'll come back here. I have this on a slide later, but I swear more than half. No, great question. Great question. I'm just glad we can come back and answer it. But bear with my structure. We'll come back to that. I tell people more than half of I get evaluations from parents and family members and people, if they're old enough, and docs and case managers and lawyers and I mean you name it. Workers' comp cases, I do those too. I do lots of legal work. I'm kind of weird. I don't mind butting heads with attorneys. I kind of like it, odd that way. But I swear, more than half of the referrals that I get, I could subsume under the question of, Dave, help me figure out what the hell's going on in this case. So, what's going on with this person? I like to think I'm practical and I'm real. I had a great supervisor who told me you don't need to use a whole lot of A words in your reports. You don't need to try and impress anybody with words like aphasia and apraxia and anosognosia. I know what those words mean, but I don't use those. So pretty real, pretty practical, pretty real life recommendation based. So great question. We'll come back to it. Yeah.
Do you have any experience in evaluating deaf individuals?
I have some. I don't claim to be an expert in that area.
Is it different than a hearing person?
The evaluation, of course, has to be different, but I use translators for people that have use sign language because I don't know sign language, so I have to have a translator there to help me. That's a more challenging evaluation to do, but somebody's got to do it. I can do it. I've done it. I also work with people who speak a foreign language, who speak a foreign, not non-English language. Again, I'm a little bit of Spanish, a little bit of German, a little bit of French, but I need somebody in there to do those interpretations for me. Interpreter. I always get interpreter and translator confused. Interpreter does the speech and translator can do the writing, I think. But anyway, so I have to have somebody in there to help me with that. But
Does that change the results much?
well,
Without
that's
having direct communication?
that's a very good question. You just have to make sure. Well, okay, this is a pretty philosophical sort of answer, perhaps, but it would be different based on how, in my opinion, how that person who is deaf has a different life experience because of that problem. But you can still do assessment, which is primarily what I'm talking about today, of things like cognition and academic achievement skills, mental skills, memory, problem solving, attention, concentration. Cognition means mental skills. So it doesn't change, it changes the instruments that you use, but as long as you can communicate with somebody, it takes longer. That's an absolute.
Like I have an adopted daughter from Liberia.
Ah.
And there's trauma there too.
Yeah.
In addition to deafness.
Yeah.
And so I didn't know how all that comes into play.
It comes into play in doing, we're Midwestern here, so we like to think we're pretty kind of so what, practical, functional oriented. So what are the questions? I'll come back to that. And how are we going to get to answering? What process are we going to use to answer the questions for you? It sounds like a duh thing, but most, in my opinion and experience, most neuropsychologists and even psychologists don't take enough of a question-oriented approach to doing assessments. So again, it sounds like a duh thing, but not everybody will do that. We have what we call at On With Life, a peer mentor. I'll use this as an example. A peer mentor, meaning a guy, great guy, who had a brain injury, traumatic brain injury, changed his life completely. He was an executive making zillions of bucks and changed his life dramatically. And he's an employee of On With Life. and he's a peer because he's been there, done that. And he works with our people that are there to help them from that perspective of he knows. And what he always says, what he always tells us as staff is, number one thing, there's lots of things we do for people, number one thing, answer questions. Answer questions. Can I get out of bed? Why can't I go to the bathroom on my own? How long am I going to be here? Am I going to get better? A zillion questions. Why does PT make me do this? So what are the questions that you have? When we get done, you'll decide whether this kind of evaluation is something that could be helpful in answering any questions you have. And then within the confines of the disability that the person has, I know a person is not defined by their disability, by the way. Words are important. But on the other hand, we can talk labels a little bit. There's pros and cons to labels. But you need labels can be valuable too. But somebody's not a quadriplegic. Somebody is a person, Mary, Fred, Joe, who has quadriplegia. If you have quadriplegia, it sucks. But if you do, you do. And now what are we going to do with life, in your life? And so from an assessment standpoint, what questions do you have? People call me sometimes and say, my doc referred me for a neuropsych eval. And I ask them, I can do that. That's what I do. What questions do you have? People haven't even considered it. I don't know. He just wants me to have a neuropsych eval. Well, you might want to get back with him or her and ask them, why are they referring you to me? And I always start, when I do an evaluation, I always introduce On With Life, again, to kind of tell people, you see, I know you see traumatic brain injury, but you're still in the right place. I can do this. I introduce myself and tell people about my background so they know who they're dealing with and have some sense of me. And then I ask them, why are you here? I have an understanding. I get medical records. If there are medical records, get me all the records you can. I love records. In legal cases, I've had boxes of records. Get me records. Let me look at them in advance. If it's a child, I do a parent interview before I see the child. And come armed with your questions. And on the other hand, in fairness, I'm not saying that everybody should always know what their questions are. People sometimes kind of figure out what their questions are when they sit down with me. I don't know, the doctors thought it'd be a good idea. Why? Well, and they may have a little bit of an understanding. But as they hear about the evaluation process, some of the stuff we're going to cover today, what I do, who I am, et cetera, then we can get to trying to answer any questions you have. And, by the way, figure out whether the question that you have for me is one that I can answer or not. I don't do evaluations to take people's money or insurance companies' money. You got to get paid, but we want to be helpful at On With Life. I want to be helpful. I have had evaluations that have lasted 15 minutes. ADHD is the classic example, where I get an X-year-old, older than you think sometimes, who's not been diagnosed. I've been doing this for 30-some years, and 15 minutes into the contact with the child, first I do the parent interview, and then 15 minutes into it, I call mom or dad back into the room and say, I think probably we're done. Because he was running around on the tables and diving under the tables and running out of the room, and every time the goose honked outside, it took 3 minutes to get him back to the table, and so on and so forth. Did I answer your question? Do you have a follow-up question?
I will afterwards.
All right, absolutely, yes. So, there we go. Testing. A neuropsychologist works with I'm not a neurologist, I'm not a physician, I'm a psychologist, a clinical psychologist. And I work with people that have had I do tiny one evaluations periodically still. There's only so much reason to do that with a real tiny one. There's the Centers for Disability and Development that's probably better at the sort of the initial look, 2 months, 3 months, 4 months, 5 months. But my back hurts more at my age when I have to work with a 1-year-old, 2-year-old, 3-year-old, because I'm down on the floor playing and testing and rolling around and having fun. I'm good with kids. I love kids. Kids see that. So I do, 1-year-old, 2-year-old, 3-year-old, 99-year-old. And there's actually tests for tiny ones. The Bailey scales of infant development. And obviously, you're looking for very small responses. We work with people that are on with life who are in a coma-like state. So some of the instruments that we use for those folks are just even looking for any kind of movement at all, any response at all. So testing to answer questions, blah, 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 blah. Again, this is a little technical. We've kind of covered some of this. Does CNS impairment, central nervous system impairment, include congenital conditions? Yeah. I ask our new staff, what do you suppose the brain's involved in? One of them says, helps you walk, right? Somebody else ventures, helps you, rhymes with walk. What do you suppose it is? Talk, helps you talk, right? And then they don't want to guess anymore. But I make people guess a couple things. Here's the short answer. They never get wrong answers. Duh. The brain's got something to do with everything. Everything. Social skills, initiation, motivation, follow through, decision making, judgment, the executive functions. We'll talk more about those. So, you know, there's a lot we don't know. There's a huge amount we don't know. What causes an autism spectrum disorder? What causes ADHD? I don't know. What causes ADHD? I don't know. What causes a learning disability? You probably didn't pick your parents well. That's part of the answer to that. There's some genetic that we don't know for sure. You know, we know what causes a traumatic brain injury if you were in an automobile accident and you hit your head and so forth. But brains are amazing. There are people that have hemispherectomies, where a whole hemisphere gets taken out. Maybe even the language area. And that person develops language. What? God knows this. Don't want to tell anybody what to think spiritually. If you're spiritual, God knows this stuff. Number one on my list of questions for God. I've been doing this for 30 some years. I could do it for another 300. And still my question would be, help me figure out this brain stuff, including kids with these conditions. And everybody's different. So all these conditions, absolutely. What is it that's wrong with the brain? We don't know. We're getting closer with some of the imaging techniques. You know, they're getting MRIs and CAT scans, or they're not as good as you think they are. They're only so good. But some of the newer ones are cooler, and the resolution that we see is better. So we're getting better at figuring out what's wrong with the brain. Now, even if we could say, oh, yep, it's in the I'll use big words here. The globus pallidum. There's the damage that causes ADHD. Okay. And what does that tell us about what we're going to do for this person? Especially with the variability. There's a saying in the field of brain injury particularly, probably applies to every condition, every human condition, whatever that condition is. Each case of brain injury is a case of brain injury. It's one case. You can have two people that have the same damage in the same area and they look very different. And you can have, the older I get, the more kids I see, the more people I work with, the more I think everything runs on a continuum. Autism spectrum disorder, they just changed the DSM, Diagnostic and Statistical Manual for Mental Disorders. They changed the diagnostic system around a lot. We got rid of Asperger's. Anybody have a child with Asperger's disorder? It's not a real disorder anymore. What? So we can debate that. And part of the reasoning is that it's on a continuum. ADHD runs on a continuum. There's a kid that comes in my office and 15 minutes later, I can't get him to pay any attention at all. And girls tend to be not quite as hyperactive motorically as boys. So there may be a real mild case where I see a 13-year-old and I end up saying, I'm confident she has got an ADD or ADHD. It's just that it hasn't been recognized because she doesn't have the motor hyperactivity. Girls tend to be more compliant than boys. They don't get in as much trouble as boys do. They're more mature than boys. So they may not get recognized. And so that's a milder thing. And autism is a great example of that. Learning disorders are a good example of that. Questions? Okay. So we have covered some of this stuff. It's all about the brain. Cognition, I'll use the term cognition a lot. That means mental skills, memory, attention, concentration, learning, thinking, problem solving. Executive functions means the higher order skills. Problem solving, judgment, reasoning, mental flexibility, multitasking, you've heard that term. Academic achievement stuff, reading, writing, arithmetic, phonics, math, reasoning, math calculation, et cetera, school stuff. People don't realize, 20 years ago, we used to have more money for the AEAs, a lot more money, more staff, therefore, more school psychologists. Neuropsychologists didn't get as many referrals for kids to do learning disorder and related evaluations because the school was able to do that. They don't do that now. They don't assess these conditions well, in my opinion, at all now. If there's teachers in here, you might be a little offended. I'm sorry, what? They don't have time, they don't have staff, and the bottom line is we don't got enough money. Everybody wants more money, everybody needs money, and what are we going to do with our money in this society? But yeah, they don't. So I see tons of kids. More than half, it surprises people there, more than half of my outpatient load, because I see people with concussions, I see people with traumatic brain injuries, I see people with dementia, and more than half my work is with kids, outpatient, with these kinds of conditions. So, and a brain, if you have a brain problem, if your brain, parents ask me sometimes, in one way or another, bottom line question, why is my child the way my child is? Because they're born that way. Why does somebody have a learning disorder is asking why, it's like asking why is somebody born left-handed versus right-handed? We don't know. You didn't pick your parents well, there's some genetic transmission of certain things. I had a dad in my office last week that said when we talked about the ADHD stuff, that comes from me. So, we're all just out there doing the best we can with our strengths and our difficulties in the world, all of us human beings. And some people, not a small number of people at all, are born with some of these congenital conditions. They're not uncommon, some more common than others. And and again, I ask our new staff, what's the brain involved in? Everything. It's called a neuropsychological evaluation on purpose. It's sort of all this neurological stuff and cognitive stuff, and it's some element of the psychological. So when I do an evaluation to diagnose one of these conditions, it's sort of as much a psychological evaluation as a neuropsychological evaluation. Does my child have an autism spectrum disorder? Does my child have a learning disorder? Does my child have an intellectual disability? I'm going down to, we have a contract with 2 of the hospital systems in town for me to do all the neuropsych evals. And I'm going down to the Lutheran psychiatry, child psychiatry unit that I go down to a number of times in a year. Every couple months I go down. And they're wondering with a 13-year-old whether she has an intellectual disability or not. They know she's got some cognitive problems, but it's important in terms of placement because certain places will take you above and, there's all these lines, right? What's your adaptive level like? What's your IQ level like? You can qualify for services under certain conditions and not under others. It's important for the waiver program. I'm not going to talk a lot about the waiver program. I'll stick around, by the way, after my presentation. I know you guys have lunch at 11:30, but I'll stick around and talk to anybody who wants to talk to me anymore. Questions? So, neuropsychological assessment gives you some idea about what's going on with somebody. What are their cognitive skills? Psychologically, how are they doing? Sometimes, when I work with a kid, sometimes it's, again, on a continuum. When I talk to the parents about how the child's doing psychologically and behaviorally, because these behavior issues can be big ones if you have a disability of some kind. If your brain is not organized in a normal fashion, it can affect everything, including your behavioral control. If you come from an adoptive background and you have reactive attachment disorder, you've had it all along, and, that can be challenging. So sometimes parents want me to go down the psychological road and dig and find out what's going on with that person. Had a young boy in who has some sexual inappropriateness a month ago, and nobody had really talked to him much about it. So I did that, and we didn't do as much in the way of the cognitive testing because that wasn't the question that that parent had. And other people say they're doing well psychologically. I had one of those a few weeks ago. She's got lots of friends and she's very social and she seems happy and we don't have any concerns at this point. And she was about 7 and starting to get more of an idea about how different she was compared to other kids and starting to make a couple of comments, about herself, that kind of stuff. But it wasn't a big issue. And what they were interested in is how's she learning, where's she at cognitively, where's she at intellectually, what are her strengths, what are her difficulties. An evaluation shouldn't be just about deficits. You're looking for deficits, of course. You want to know if there's problems so you can address them the right way and help provide recommendations to parents and schools. So sometimes I take more of a psychological, I always ask parents, do you want me to go down the psychological road or not? And sometimes the answer is, oh yeah. Sometimes no. And sometimes kind of in between. So I may, if I do kind of a psychological look at a kid, and I always do with adults. I always ask adults, how are you doing? What's your mood like? How are you feeling? How's this all going for you? But with kids, that can be threatening and it may not be the question that you have. So answer questions. It sounds like a duh thing. I tell my students, answer questions for people. That's why you went to school for all those years. You answer questions. You should know things. Oh, boy, I don't remember that ever going backwards. Am I hitting the wrong button? Oh, I was. Sorry about that. Dude. Okay, questions? Yep.
Most of the time, is it just one session?
Good question. Good question. I talked to somebody earlier. I have done evaluations in 8 sessions. Why? Because that's what we had to do. Because after 15, 20 minutes, here's an example. I'll use the inpatient population as an example. Some people's fatigue is so great that after 15, 20 minutes, they're done. So, you can test them for hours. I spend hours and my assistant tells people, plan on the whole day. Really? The younger you are, the less time you're in there. Sometimes we're done by noon. I take lots of breaks. We take a lunch break. The point is to get optimal performance. The point isn't to make it too hard on somebody. You're looking for optimal strengths and what difficulties are there. So I always ask. I ask people, and Megan, my assistant, does. Do you want to do this in a day or do you want to do it over more than one day? And it's your call. And then we play it by ear. I've had kids in where, again, 15 minutes, we stopped and said, you need to talk to your doc about meds for ADHD. We can talk about that a little bit more later if you like. But most of the time we can do it in a day with breaks, get a juice box and a fruit snack halfway through the morning, do a little play time. The younger you are, the more you got to incorporate play into things. So that's my job, to kind of balance getting the task done so I can answer your questions and making it as enjoyable and fun as it can be under the circumstances. Some of the stuff, I tell kids this, and I tell parents to tell your kids this. Some of the stuff's boring, and if you don't like school, you're not going to like some of this stuff. If you don't like reading, writing, and arithmetic, we're going to do some of that. But some of the other stuff's like games too. If you like drawing, or you like telling stories, or you like, putting blocks together, some of the stuff's fun. So whatever, again, I'm a good Midwestern boy, whatever makes sense. And I need you to tell me that. If you want to set it up over 8 one-hour sessions because you really think that's the best way for us to get good data to answer your questions, I'm there with you.
Do they change? Because my daughter had fallen off a horse before and lost consciousness. And so anyway, as part of it, they offered to do a psych eval, a neuropsych eval, just to make sure that she was able to perform like she was prior to that.
Right.
Okay, that's been several years ago. If she had another evaluation now, would that be different, or the things that you find are consistent right on through life?
It would be different in the sense of whether you're working with somebody different compared to who you worked with before and what they did or didn't do. There are good and bad everything in the world. There's good and bad plumbers, there's good and bad secretaries, there's good and bad neuropsychologists. Some have more experience, some have less. Some people in Iowa are pretty good, some in Iowa are not as good. So it depends on what was done before and whether the testing process would be different. It may depend on whether it may be different based on whether your questions are different than they were before. That's the first part. What was the second thing that you said? You asked? Would it be different?
Well,
And
I'm thinking as far as like learning and
Yeah.
thought process
Right.
and stuff, would that still be pretty much
oh,
the
after,
same?
after
That's-
concussion?
Yeah,
Well, it depends. It all depends.
well, I mean, the evaluation was done and everything appeared to be normal compared to what she was prior,
Good to hear.
but now.
Then it shouldn't be different based on that concussion. I mean, that's one of the things about concussion. People don't, you get knocked down after a brain injury, and a concussion is a kind of brain injury. It's milder, but it's a brain injury. And then you're getting better. Different skills get better at different rates, makes it complex, but you're getting better. We don't know. Some people recover real quickly, other people take lengthy periods of time. But if you're hearing that the person is back, or 99% back, to where they were before, you don't expect, and in any case, you don't expect after a concussion a downward turn. You don't get better from a brain injury and then get worse a month, a year, 2 years, 10 years later based on the concussion. There may be something else going on, whether it's something else psychologically or something else medically, neurologically going on. That's one of the rule outs. If you've had a concussion and you've gotten better to whatever degree, 99, 100%, 60%, and then you start declining, you need to get in to see your physician first to do the medical rule outs, because that's not good. People are not supposed to decline unless you're, 70 and you're starting to develop Alzheimer's or something. Did I answer your question? Okay, what follow-up do you have?
Well, I'm thinking more in the lines of thought processes, meaning the way they figure something out or the way they understand.
Right?
Because I didn't know if just the fact of growing up, maturity,
Sure.
or learning to compensate
Oh,
for
sure.
that their cognitive.
It's all relevant. Human beings change. If you're 40 and I see you again at 41, that's different, But kids are developing all the time, absolutely. Part of the reason I did a presentation yesterday at Mercy Hospital, I was talking about brain injury, but I moved into adolescence because I wanted to illustrate the frontal lobe and sort of this issue. Your frontal lobe, which is the most advanced part of your brain, that's where the executive function is, doesn't stop developing until you're in your early 20s, which is why teenagers do the crazy things they do. Because their frontal lobe isn't developed enough to control their behavior. Who on earth would jump off of a building with a sheet thinking that it would serve as a parachute, like my son did? My son, being a smart ass, because he gets that from his mom, used to say, if he didn't think it pissed me off too much, well, Dad, my frontal lobe isn't going to be done developing until my early 20s. So absolutely, you got to take all that into account. You don't expect somebody at 13 to be the same in any way, as they are at 9, or at when they're 7 compared to when they're 6. So you have to take everything into account. Here's another way to look at a neuropsychological evaluation. One, help me figure out what the hell's going on, answer my questions. 2, or another way to look at it, help me understand this person and their strengths and their difficulties and so forth and so on. Okay. So, has the person had a brain injury, or is there something wrong with their brain? Oh, yes, question. Yeah, I'm listening. I'm just going to pull these up so you can be reading them. Yeah. 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 Oh yeah, and I do
I don't
those.
see anything else, but I hear you describing something
Yeah.
much different, where you would do a larger assessment that would maybe help us with, plan B, plan B, plan C.
Absolutely. I can do the short thing or I can do the long thing. I'll come back to you. The evaluation at Lutheran that I'm doing next week on the 15, she's 15 actually, is, Dave, we don't know where she's at cognitively. We need an IQ and an adaptive measure, an adaptive skills measure to go along with that. But we're open, because they know me now, we're open to a broader look at where she's at cognitively, because we're interested in her IQ, and that's important for placement and services and that kind of thing. But we want to understand her too, and they know I can be helpful in that regard. They think I can be helpful in that regard. Okay, that's where I wondered if you were getting to. Well, good question. That's where I thought. That's where I thought you were going to end up. You guys may have some thoughts about this, and please comment, but I don't think you'll disagree. I want to answer questions. I want to help you understand. I'm objective. I have to tell you what I think. I have to tell you if I think the person is appropriately or not appropriately diagnosed with an intellectual disability. I'm not an advocate for you to get services. My job is to objectively evaluate someone. Sometimes I do evaluations and people don't end up happy because the findings don't allow them to get certain services that they want. If I don't think your child has autism spectrum disorder, that's why you're coming to me to make that diagnosis. If you're concerned, then don't bring them to me. If you have some concern about where the IQ score is going to be and it's going to change the kind of services that you get based on it, all I can tell you is that my job is to be objective and to tell you what I think. So that has happened. I've had people who've done reevaluations, and I have disagreed with what's been found before. That's any professional doing this kind of stuff. Especially when people kind of hover in that area where between what we call an intellectual disability and a borderline intellectual functioning diagnosis. And there's a line, and the line's got to be, the line's got to be somewhere. You can't give services and funding to everybody that's got an IQ of 99 and below. 100 is exactly average. Are you less capable at 99 than 100? Well, technically, statistically, I suppose. But it'd be like providing special education services in the school to everybody that scores at the 49th percentile and below. Half the class. Because half the class is better, half the class is worse. We don't have the money to provide. Now, does somebody need help that's a little behind in math? Absolutely. I say in my reports, they need help in math. They need help in written expression. They need help in spelling. They need help in mathematics, reasoning, blah, 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 blah. But I can't say for that child, they have a learning disorder and therefore qualify for an IEP and need special education and all the accommodations, reasonable accommodations and assistance that they can get if they were able to be diagnosed with that label. So I tell people what I think. Did I answer your question? Okay. Good question. Oh, well, that's a very good question. I legally, I provide every parent or person, if you're, coming in to see me yourself, a copy of my report. Most professionals don't do that, which blows me away. I don't think that's right at all. If I go in to see a foot doc, I want him to send me something in writing. I want to know what you thought. That's why I came to you. I had questions about my foot. But we don't do that in the medical world. People cover their asses a lot. That's part of it. So I send my report to you. Sometimes people aren't happy with my report. I'll talk to them about it afterwards, if you like. You get a copy of the report. If it's a physician that's making the referral, the physician gets a copy of the report. If it's workers' comp and they're paying for it, they get a copy of the report. Those are the automatics. Otherwise, nobody gets a copy of that report unless you sign as a parent or a person a release for me to send it to someone. And then I'm glad to. I've sent reports out to 20 people before. Oh yeah, send it to all these 6 docs, and I want you to send it to my eight cousins because they're interested. And we do that, actually. What do you list everybody on the sheet and we'll send it to them. We don't mind spending the postage. And then you have to decide, you got one report saying that qualifies for services. You've got my report saying they don't. That's the harder thing, obviously, than they didn't and now they do. If they do, then you go, okay, well, this is easy. You have to decide what to do with my report. I can't tell you what to do with my report. And I don't know the law well enough to know the legalities about what you're supposed to do or not supposed to do. Anybody know that? If you're getting services and you get a report from somebody else that would change those services if people knew about it, what are your legal obligations? Seems like you'd have to, she says. Yeah, what if they don't have the data? What is the ethical/legal, and these are different, ethical and legal are different. What's the ethical and or legal responsibility of somebody getting a report that would take services away from someone? Yeah, and the implication, if I read you right, and I agree with this, the implication is, well, again, it's what's ethics and what's law. What is somebody's legal responsibility? They brought them into, because this happens. People bring people in to see me.
If they're already in services, and if you're being reapproved for service, I mean, there's a difference. If you're looking at getting services, that's one thing.
Well,
If you're already in services and you're looking for a higher level of care, I mean, it's a fine line, but IME.
Well, and those are different circumstances. If somebody knows that you're having a reevaluation done, they're going to want to know what the results are. But what if somebody just, because this happens, people bring, I haven't had my child evaluated. I want to know what their strengths are, what their weaknesses are. I want to tell the school. I want to help them the best I can. I want to help my child. Oh, wait a second. You found what in your evaluation? That could affect services. But nobody's out there looking for it. Okay, we got to move. I could spend hours with you guys, and I would love to. Do I really have 10 minutes? Holy cow. All right, some of this I've already covered. Brain injury. We're not going to have time to talk about brain injury a whole lot, but that's okay. So, I always have recommendations. That's why I tell my students, people are coming to you because you're supposed to know something. You're supposed to have recommendations when you're done. Guardianship becomes an issue sometimes, including with kids. I get, my child is not ready to be out there in the world, and I'm concerned, and now they're hitting 18. Where are they at? I'm thinking about guardianship issues. That's, I see a lot of nodding heads. What are their strengths and weaknesses? In adults, I have to worry about malingering. I don't so much in kids. Kids don't lie quite as sneakily as adults do. And I get an adult who says, yeah, I had this concussion and I can't work anymore and I'm all effed up and I don't know. So I have to evaluate for malingering, faking bad. Kids don't have to worry about that quite the same way. Return to work, return to school if you've had a concussion. Recommendations for psychological, behavioral, or cognitive therapy. Sometimes, I will say this, sometimes do not have your youngster come to me if your number one and only question is, what do we do about the behavior problems? I've done those evaluations before. I run our behavior team at On With Life, but I don't do follow-up therapy work, and we don't do follow-up therapy work. So I don't do primarily, what am I supposed to do about these behavior problems evaluations? You need to see a child psychologist.
Well, just one of the things that I hear from people, like from the AEA, is, because they can take neuropsychological testing in consideration when they're determining services in the school and needs in the IEP. But on some evaluators' dictations or forms, they're able to take that information and utilize that in the schools. It's in a format that is user-friendly with the schools where they can implement some recommendations.
Yeah, but how do you know whether the person you're seeing is competent or not competent, good or not good, experienced or I don't know either. I'm working with an attorney right now about a legal thing, and I'm starting to wonder, is there somebody else that might be better?
But there's no.
And I got a good recommendation for him.
Well, is there things that you do that other neuropsychologists
Well, that's a good question.
that go
Yes.
above and beyond, maybe?
Well,
of the
yeah. I'll brag on myself a little bit. I'm don't
I
try
mean,
not to do
just
that too
so-
much,
'cause we
but
don't have an idea, and that's
well,
my question.
here's some bottom line things. Can you get your child in reasonably quickly? Is important. Some people have late waiting lists. We take a lot of pride in getting people in within a month, 6 weeks tops. More importantly, do they get their report done, sent out in a timely manner? There's one neuropsychologist in town that may have good background, but is known for not getting a report to parents. I get things within a week. Most neuropsychologists around the country, if we had all of them in this room right now, 99.999% of them would say, oh, we don't do that. It takes us longer. It shouldn't. But my bosses let me run this job such that I can do that. And if they didn't, I might not be working there. So you never see that. People, it's shocking to me in the neuropsych world when I tell people, yeah, I get my reports out within a week. People are shocked by that. I had, real quick story, I tell too many stories, I know. I had the medical director of the Creighton University MS clinic. People with MS can have changes in their brain, they have cognitive problems. And they started sending, they had a neuropsychologist there, but they started sending all their neuropsych referrals to me. This is neuropsych humor. And he said, so because it was taking too long to get them in to see their neuropsychologist, and if you're busy, you're busy. But more to the point, it was taking them months to get a report. So his comment to me was, I want the evaluation report to know what you think. That's why I sent it to you. Before my patient is either cured or dead. Good. It's nice when somebody laughs. Neuropsych humor.
But also,
But
I
there's a
think,
point
too,
there.
the information on the report that, your SEL and, your providers can utilize that information as you're setting goals in the school and,
Yeah.
with the waiver services, because not all
It's important.
reports is in a format that you can take that information and that data that you learn about your loved one and implement that in the home and community.
This is important. I did an evaluation a couple weeks ago. We don't have a whole lot of time left in the school year. And so the mom was saying, well, we don't have a whole lot of time. Because they didn't have an IEP, I recommended that they have an IEP. They need an IEP. Well, there's only so much time left in the school year. And I said, no, we can do this. Be assertive. A month is a month. School can accomplish a lot in a month to help a child. But you got to push, and you may know this. That's another issue. There's only so much money in the school. There are some schools where the principals actually will tell their teachers, a little secret here, to kind of don't go down this disability road quite so strongly, and that's wrong. There's laws. There's the AEA and the IDEA on purpose, because if you have a disability, a child, you have a legal right to all those services. And so I want to get my report done as soon as I possibly can. Sometimes I get done in a day. That's the bottom line. What are the real, and I'll take questions. What the heck is going on in this case? What is wrong with my child? And again, we're born the way we are. I have my parents to blame for I had glasses from the time I was 5. But they had parents too. And their parents had, we're all humans, we're out there doing the best we can with our strengths and our deficits. Why does somebody have the social skill deficits that go along with autism spectrum disorder? Because that's part of the medical problem. Why does somebody have problems with reading and writing? And that's part of the learning disorder. You can overcome a lot in life. Great HBO special about 1.5 years ago, by the way, on learning disorders, where they interviewed a lot of famous people, very successful people who've done very well in life despite their learning disorders.